Well, hello there, future nurses. Welcome back to Med Monday. I'm Cynthia, the creator and lead instructor for Nursing School Simplified, and I am so glad you're here today. So, today we're going to be talking about amlodipine. Now, the reason that I have written it like this is because in pharmacology, you will notice that certain medications are written with uppercase letters in the middle or at the end or in the beginning of the name of the medication. And these are called tall man letters. And the reason that they do this is so that you can easily differentiate between this medication and something that may look similar or be similarly spelled, so that there's no confusion and that you don't make a med error, right? Because we don't want to make med errors. So today we're going to be talking about amlodipine, and we're going to jump right in and get started and try to get this done in under 5 minutes. Oops, there we go. Sorry. There we go. All righty. So welcome to Med Monday. There we go. Amlodipine is the generic name, and the trade name is Norvasc. This is an anti-agonal and antihypertensive medication, and its chemical class is calcium channel blocker. And this medication is given PO, which is orally. So it inhibits the calcium ion influx across the cell membrane during cardiac depolarization. And it also produces a relaxation of the coronary smooth muscle and peripheral smooth muscle. So that is going to work on the blood pressure. And it dilates those coronary arteries, and it increases myocardial oxygen delivery in patients with Prismetal's angina, or angina, if you want to say it fancy. So the indication, or why we give this medication, is for patients with chronic stable angina pectoris, or chest pain. And we give it to patients with hypertension, and we give it to patients with Prinzmetal's angina, and that is basically coronary artery spasm. So contraindication, or why we don't give this medication, again, hypersensitivity, severe aortic stenosis, severe obstructive coronary artery disease, and we want to use it with precaution in patients who are pregnant or breastfeeding, children, geriatric patients, as always, patients with CHF, and patients with hypotension, and patients with hepatic injury. So side effects, which remember are non-life-threatening, include dizziness and fatigue, and this could be from a lowering of the blood pressure. So let's say your patient's been running around with high blood pressure, and we give them a medication that lowers it. They're going to get a little dizzy. They might get a little tired because they're not getting that cerebral perfusion from the elevated blood pressure. It can also cause peripheral edema, hypotension, bradycardia, and then there's some GI symptoms, as always: nausea, vomiting, diarrhea, and constipation. Sexual dysfunction in men, so impotence, because we lower the blood pressure and therefore they can't get the blood flowing where it needs to go, and pulmonary edema. So adverse reactions are things that are life-threatening, and that would be severe hypotension, severe bradycardia, pulmonary edema, and anaphylaxis. So what are we going to be monitoring? What are our nursing considerations? Well, we want to monitor our patient's blood pressure, heart rate, and the rhythm, because it's a calcium channel blocker. It can change the rhythm. We also want to remember that it has a black box warning for patients who have hypersensitivity. We want to monitor our patients for peripheral edema, dyspnea, JVD, and crackles. So JVD is jugular vein distension. And what would that all mean? It means that they're in fluid overload, or they could be in pulmonary edema. We want to monitor their ECG or their EKG. And we want to make sure that we're monitoring our chemistry panels and a CBC. And we want to monitor our patients for angina, and we want to ask them the intensity, the duration, the frequency, and the location. So, patient teaching, what are we going to teach them? As always, take this as prescribed. Don't double dose if you miss one. There's a black box warning for hypersensitivity, so report any symptoms to your physician. We want them to monitor their heart rate and blood pressure, so we make sure that we teach them how to do that. That they need to avoid certain over-the-counter medications and herbal supplements, and so they should always be checking with the physician or the pharmacist before they take those medications. And they need to be notifying the physician if they have any irregular heart rate, if they have any edema or severe dizziness, hypotension, chest pain if it does not improve, and they need to change position slowly because remember, they could be experiencing orthostatic hypotension. And so that's it for this Med Monday. I do want to let you know that I have a podcast and it's available on Apple Podcast and Spotify, and I think it's on Amazon Podcast now. But there is an episode that I recently did on the 3 types of angina. And so it applies directly to this medication. So you can go to the Nursing School Simplified podcast on Apple Podcasts or Spotify, and you can listen. Oh, and we're on iHeartRadio too. And you can listen to it there. I also do post that here on the Facebook page and inside our Facebook group. So if you want to get a little more information on angina, go ahead and check out that podcast. So until next time, I hope you guys have a great week and keep working on your dream. And I'll see you.